It's the target we've all been waiting for. More than 75% of eligible Canadians now have one shot and 20% are fully vaccinated. That was the line in the sand the Public Health Agency of Canada set to start loosening restrictions. But despite that, the Canada-US border will remain closed to non-essential travel for another month. And there is still no clear plan on what the reopening will look like.
I can tell you there is a tremendous focus on making sure we're working together to do this as quickly and safely as possible, because we all want to get back to normal, which means, yes, moving quickly, but it also means avoiding any further massive waves.
While calls in Canada grow to reopen the border, there is also a strong push in the U.S. as the European Union lifts travel restrictions for U.S. travelers.
Our border between the United States and Canada remains closed, leaving people unable to access their property and keeping loved ones separated for over 15 heartbreaking months. This move by the EU would allow my Buffalo neighbors to take a 9-hour flight to Paris, France, but they can't take a 90-minute drive to Paris, Ontario.
So why do Canadians not yet have the concrete details? And what about the economic impact as businesses face another lost summer? Let's find out. Joining me now is Congressman Brian Higgins, who represents Buffalo and Niagara Falls, New York, in the U.S. House of Representatives. Congressman, thanks so much for joining us. Now, you've been very vocal about wanting to reopen that border. In fact, you used some very spicy words in a tweet on Friday about how disappointed you are in the border, that the border is going to be closed until July 21st. How disappointed are you after all your long battle?
Well, I'm disappointed on behalf of Canadian citizens and United States citizens. We have been told for the past 15 months that the inflection point, the game-changing moment, would be the availability of vaccines. And nobody anticipated the power of this medicine against the disease, COVID. If you are fully vaccinated, you pose a very low risk of getting COVID or giving COVID. And that needs to be recognized. Loved ones who have been separated for 15 months need to be reunited. People that have property in Canada and Canadians that have property in the United States should be able to enjoy their property so long as they are fully vaccinated. Whether it's 20% of your population or 45% of your population, the fact is, if you're fully vaccinated, this is the science. These are the facts. This is what we've been told to follow for the past 15 months. And now the Canadian government, which I said is BS, I wish I could find a more artful way to say that, is not providing any guidance as to what it intends to do over the next 30 days toward the goal of a partial or full opening of the U.S.-Canadian border.
So, yeah, exactly, Congressman. Over about 75% of eligible Canadians have had a first shot, around 20% or more have had a second shot. How much does the pace of Canadian vaccination help your case, help you argue your case to open things up?
Well, I think it's important, but I also think you need to recognize the power of this medicine. Nobody thought that this vaccine would reach the efficacy rate that it has. It's 85, 90, 95%. What was hoped for was about 60%. So not only is this a very powerful medicine that provides immunity from getting COVID, it also provides a very strong medicine from all of the variants associated with the coronavirus. Look, the coronavirus is probably going to be with us for the next decade or so. The question is, can we manage it well? And with these vaccines, we can manage it well. The other thing that I take great exception to is the National Hockey League. I love hockey. I played hockey in Fort Erie. But the National Hockey League gets an exemption, not based on the science or the data, based on the Stanley Cup playoff schedule. That's arbitrary. We're just simply saying, look at, in the United States, we have the Centers for Disease Control and Prevention. And the guidance on this is very clear. If you're vaccinated, you don't have to wear a mask. You don't have to socially distance. You don't have to quarantine. All of that is in the past because there's a new reality now, and it's a powerful medicine against the coronavirus. And what have we been told on both sides of the border for the past 15 months? Follow the science, follow the facts, follow the data. This is what my frustration on behalf of both Canadians and Americans is with both the Canadian federal government and the U.S. Canadian government. I was in contact with the White House yesterday and expressed this in no uncertain terms. We should take unilateral action here on the American side and open the border.
Oh, well, that's interesting. So when you asked that question to the White House, let's just open our border to Canadians and let the Canadians stop and do whatever, have whatever restrictions on their side of the border, what did the White House tell you?
Well, that's unfortunately, that's the problem. The decision it's too much bureaucracy. Nobody seems to be making a decision on this. I've spoken with the highest levels of the Biden administration. They have to bring it back to a task force. There are two people that can make this happen. The President of the United States, Joe Biden, the Canadian Prime Minister, Justin Trudeau. They're men of goodwill. They have a good working relationship. When you close the border at the middle of a second tourist season, hurting both Canadians and Americans without any vision about what the plan is over the next 30 days to do everything they can to open that border either incrementally or more comprehensively, that is a terrible disservice to the people of Canada and to the people of the United States.
So where do you put that blame, Congressman, for the border still being shut down? Is it with Joe Biden, the president, or with the Canadian Prime Minister?
I think it's the binational bureaucracy. I think that oftentimes good scientific information, there's a delayed effect, that it has to go through this bureaucratic process, and too many people are weighing in. Bureaucracies are typically risk adverse. There's very little risk here because, nobody's talking about herd immunity anymore because it's not as important because you have these very, very potent, effective vaccines against the disease, against giving it or getting it. And if you are fully vaccinated, be you a U.S. citizen or a Canadian citizen, you pose very, very small risk. And that needs to be recognized because that's the science, that's the data.
Would you consider, opening your border, let Canadians in to get, say, that second vaccine?
Yeah, we asked for that 3 weeks ago. And we have surplus vaccines that are being thrown out, that are being discarded as medical waste because they can't be used. Why can't, if you have somebody in Canada that wants a vaccine and they can't get it in their country, it seems to me that during the pandemic, an essential traveler would be one coming from Canada to the United States to get a vaccine that otherwise would be thrown out and then driving back to Canada. There's no risk in any of that. In fact, you're encouraging vaccination and you're increasing the number of Canadians that are vaccinated.
New York Congressman Brian Higgins, thanks so much for sharing these thoughts with us. Have a wonderful day.
Thanks, you too. Thank you very much.